Hi everyone. I might maybe start the session. We're starting a little bit behind time, but we have a little room, I think. But I am conscious that we have another panel session, one session 3 starting at 3:15. So I think it's a good idea for you to get going. So welcome. I know it's been a very exciting and passionate and insightful morning, and I know we're going to have more of the same in this particular session. My name is Fennell, and I'm chairing this session, and I'm really, really pleased to do so. It's on practice perspectives, and I think one of the richness of this entire day is the variety of perspectives that are being brought to bear on a very important topic. And so in this particular session, it's the perspective of practice, which I think is a richly important one, where we see the system not dressed up for inspection, but how it actually operates on the ground. We have 2 really interesting speakers for you. Our first one is Julia Kenny, who is Policy and Research Coordinator with NIACRO. She can tell you what that stands for. They no longer use that, they call it NIACRO. So she's Senior Practitioner in Public Affairs and Communications team there, and has responsibility for policy, research and communications. Professional background in policy research and public affairs consultancy, and a BA on the English and politics from Stirling University, and a Master's in Communication from the University of Ulster. It's a voluntary organisation, and NIACRO has been working for more than 40 years across Northern Ireland to reduce crime and impact on people in communities, with children and young people, people in prison and their families, and adults in the communities. So she's particularly well placed to address the theme of this session. So please welcome Julia Kenny.
Thanks Caroline, and thanks to Aisling and Fiona for inviting me to speak today. Glad to be here. As Caroline said, I'm Julia. I'm a Policy and Research Coordinator in NIACRO. My role in the organisation is taking the experience of our service delivery and translating that into workable policy and communicating that to various stakeholders, including politicians and the media. So NIACRO is a voluntary organisation which has been working for more than 40 years across Northern Ireland to reduce crime and its impact on people and communities. Caroline alluded to, we've recently had a name change. We were always the Northern Ireland Association for the Care and Resettlement of Offenders. That's a bit of a mouthful, so we're now just NIACRO. We work across Northern Ireland with offices in Belfast, Derry and Portadown, but we also work in each of the 3 prisons in Northern Ireland, and we have bases in the probation offices as well. So we work with people in prison and their families, adults in the community, and children and young people. We deliver a range of services through our projects, including early intervention work with children and young people, training and employment support services for adults and young people, tenancy support and community intervention, and family support for those affected by the criminal justice system, including direct support for families and managing visitor centres at McGilligan and Highbankwood prisons. The experience of delivering each of these services informs our policies and messages, which we communicate to influence change in attitudes, practice and legislation. The project I'm going to be focusing on in my presentation today is a project called Family Links. Family Links aims to maintain and enhance positive contact between people in prison, their children and families through a range of support services. It's been operating since 2006 and was a successor to a project called Prison Link. Prison Link began in 1987, and at the time it symbolised a unique partnership between the prison service, probation in Northern Ireland and the voluntary sector. It embodies NIACRO's aim of reducing crime and its impact on people and communities by its mission to improve the life chances of people affected by the criminal justice system. And we do this through offering a range of practical and emotional support. Just to put this project in context, in Northern Ireland there's an estimated 1,500 children at any moment that have a parent in prison. That's in the context of an average daily prison population last year of 1,826, so quite a high proportion. Of the 120,000 visits to Northern Ireland prisons, 36,000 are made by children, which Linda will probably explore further later. And of course, like here, there is no statutory responsibility for the children of people in prison. So Family Links works to improve the life chances of families in the criminal justice system, and we take a holistic approach to this. So the project's objectives are to contribute to the resettlement of people who have offended, contribute to the diversion of children and young people from offending, reduce the impact of imprisonment, and contribute to the safer custody agenda. I think the rationale for this kind of project has been explained already, but just to give you an overview on where we're coming from. Like I said, we operate on an outcomes-based rationale with an emphasis on holistic approaches to resettlement. For the person in prison, and most of our work starts with the person in prison, the evidence shows that maintaining contact with family on the outside reduces the risk of reoffending upon release. Having that family support structure facilitates assistance, and it supports the rehabilitation efforts while the person is still in prison. And it usually means that there will be that same support structure when they're released, and stable accommodation, which then will support employment efforts as well. It also improves the mental health of the person in prison. We conducted some preliminary research into the prisoner ombudsman's reports in Northern Ireland for the death and custody reports, and found that in several of the cases, lack of family contact was a direct contributing factor to the death in custody. As well as that, there's also benefits of the work for the partner or the spouse left behind. We run respite for some of the families that we work with, and feedback from one of them was saying that when a partner goes into prison, you become mum and dad, and we heard that earlier this morning as well. Family Link sort of works to relieve that pressure. There's mental health impacts for the partner, and we would provide sort of emotional support for that person. Also easing the financial stresses that come, especially if the person in prison was the main income bringer. So we can also signpost to services in the community as well as providing that immediate support. It also supports and prepares that partner to help with effective resettlement, what to expect when somebody is released from prison, and how they can help. As for the child, we've already explored this morning how projects like this can help protect the child's rights, including the right to family life and the right to maintain contact with both parents. Work like Family Links improves the mental health outcomes of the child as it supports the child's family to understand and address the confusion, anger, secrecy and shame that can come with a parent in prison. In a similar way, it also helps improve their educational outcomes and their engagement with education, and again we can refer on to other services that will support that further. This kind of holistic approach can also help break the cyclical nature of offending. We already know that children who have a parent in prison are unfortunately more likely to go on to develop offending behaviour themselves. But by providing support and information which relieve that feeling of abandonment, and by facilitating assistance for the parent, that cycle can be broken. This project can also help identify early signs of antisocial behaviour and support the parent to address that, and the school as well, perhaps by referring the child to another service. So Family Links, first of all, is a universal offer of service to anybody who needs it. Usually we get the referral from within the prison, so usually the person in prison will contact Family Links when they're doing the rounds on the landings and identify a family member for us to contact. We always try to contact that person by phone within 24 hours. And then if the person does want it, and usually they do, we'll send out an information pack. And that'll include all the kind of information that nobody tells you. Things like when the visiting times are, how you get there, what kind of things are you allowed to send into the prison, what are they allowed to wear, what can you provide. We'll give one-to-one support through home visits, as well as sort of offering welfare advice or any other kind of practical advice that for a lot of people aren't used to being the sole carer for the child, or just suddenly are on their own and need support to do with everyday things. We've had examples where one man lived with his grandmother and she didn't know how to pay the electric bill herself, she didn't know how to order more oil, things like that we can support with. We also offer transport to prison visits. This can include, so we have a bus that we would offer a free phone service and collect people, but we also have volunteer drivers who will go out to the more rural areas and bring people to the prison visits. We have a couple of group supports. There's one in Ballymena, I know, and there's a few others scattered around the country where we'll just sort of facilitate people going through the same thing to sit around and share their experience. Like I mentioned earlier, we have a respite once a year, and that's just sort of a weekend where it's usually wives and children who come along who've been working with us maybe on a longer term basis, who've maybe been affected by this for a while. And that just provides the opportunity for them to relax, really. The feedback that we get from that is that you can put your guards down, and some of the mums said that it's nice to not be judged because everybody's in the same situation. For the children, any kind of fear that they have in the school playground, that's gone because everybody there is in the same situation. We signpost to other community services, maybe counselling, things like that. And we can also go in and liaise with schools where the parent needs us to. Like I said, we offer emotional and practical support, and above all, we offer communication and information in what can be a really isolating system for a lot of people. We also have good links with each of the prisons, so that if somebody is concerned about their loved one in prison, we can call somebody on the landing, we can call the governor and just check things out. You know, if they're worried that they're being harassed, we can check out what's going on and that person is okay, which is particularly used early on, just after committal. So last year we received 1,864 referrals. We work with approximately 1,500 families a year, and the majority of our referrals are male. So it goes to say then that the majority of our service users are female. We refer to several other services, including services that we also offer ourselves in NIACRO. Like I mentioned, we have welfare advice, so the family links practitioners can offer immediate sort of advice, but we also have specialist benefits advisors who can make sure that families are getting the appropriate support where they need it. We can refer onto our Child and Parent Support Project, which is an early intervention project that works with both children aged 8 to 13 and their parents to make family life better and introduce better engagement with education. And we also have MOVE, which is kind of like CAPS but for older children. It's for 13 to 18-year-olds who are at risk of offending, who are matched with a volunteer in their own community. Like I said, we can also refer on to professional counselling services or trusts and charitable foundations that families can apply to for help with things like the cost of school uniforms. Recently, we've started up a pilot project in the Southern Health and Social Care Trust as part of Family Links. This is called Inside Education, and it's about delivering information and training sessions for teachers. A Family Links practitioner will go into a school and introduce the kind of effect of imprisonment on a child. This started off in one school where there were a couple of children with parents in prison, and we're trying to roll it out. We're trying to get more support for this. We give them information and resource packs and really explain what is a process that a lot of the teachers have never even thought about before. Included in that is the opportunity to visit a prison. So we took a group of teachers to McGavry prison, which is our high security prison, and for the first time they got to experience what a child goes through whenever they visit the prison, including the searching, including the sitting across the table. And I think a lot of the teachers found it really shocking that they didn't know that the children in their class were having to go through that. And that's something that we want to roll out, not just when there is an immediate concern, when a child in a class has that issue. We want all teachers to be aware of that and have the knowledge whenever they're addressing their classes. So as well as the service delivery, we try to translate that into workable policy. Sorry, there's Lucy. We try to translate that into workable policy and influence our local government in Northern Ireland and the media. We ran a campaign called Stop the Silent Sentence, which we revisit regularly. This included an event up at Stormont in Parliament Buildings looking at the impact of imprisonment on children, which Lucy spoke at in those Parliament Buildings. We also engaged with the Department of Justice and Department of Health, Social Services and Public Safety with responsibility for children, and with various MLAs as well to really raise this issue, because it's one that, despite the legacy of the Troubles in Northern Ireland, a lot of people don't really consider. We also engaged with the media and ran it in our own external magazine, NIACRO News. We hope to continue all this kind of lobbying and policy work, starting with a Justice Series seminar in January, focusing on child impact statements and revisiting the impact of imprisonment on children. However, there's definitely more to do. Like here, we don't assess the need at the minute. There is nobody counting the number of children impacted by imprisonment To make sure that their needs are met, we really need to assess and address that need and actually start counting them. Ideally, we'd like to introduce a statutory obligation for the children of people in prison to be considered. There's currently a private members bill progressing through the Northern Ireland Assembly with Stephen Agnew MLA about the statutory duty to cooperate on children's issues, and we're hoping that this will really shine a spotlight on the need for joined up working when it comes to children's issues. We recently gave evidence to the Justice Committee on the Justice Bill that's currently going through as well, where we raised the issue of families of people in prison as indirect victims of crime, and ideally we'd like to see them getting full victim status and the same kind of support in the community. And of course we're keen to develop our partnership working. We already have good links in the UK and Ireland and Europe, and we're keen to develop those and learn from our colleagues in other jurisdictions. So that's all from me. You have my contact details there, and if you have any questions about the work at NIACRO or Family Links, please let me know. Thank you.